The senator from Kansas is recognized.
I ask unanimous consent the quorum call be lifted.
Without objection.
Mr. President, thank you. Last month, the American Red Cross began sounding the alarm on a national blood crisis, the first they have ever declared. COVID-19 has added extra volatility to the blood supply, and this shortage strains hospitals and patient care throughout America. We continue to face the critical blood supply shortage today, with Kansas's blood supply standing at a 1 to 2 day inventory. I've heard from medical professionals, doctors and nurses, others in Kansas about the tough decisions rural doctors and healthcare providers are having to make, including canceling surgeries, blood transfusions, and possibly not delivering babies because bleeding complications may require blood that these facilities just don't have. My hometown is Plainville, Kansas, population about 2,000. We're fortunate to have a county hospital with dedicated healthcare professionals and physicians. One of my hometown physicians, Dr. Sanchez, who I'm told is not on Facebook very often, but posted his plea for people to donate blood. Dr. Sanchez's Facebook post says, this is his story. Today we had to tell a patient with heart disease that the blood transfusions that have prolonged his life with marked improvement in quality could no longer happen at Brooks County Health Center. My patient and his son were understandably upset. It just so happens that the same patient was told a few days previous that the melanoma cancer that he'd beat for 40 years back returned. And now, no blood transfusion. The doctor says that the hospital is considering canceling surgeries, possibly even not delivering babies. Our stock of common blood type A positive and donor O positive blood units are down over 30%, from 6 units to 4 units. The universal donor O negative blood has been in short supply for months, maybe for years. Blood supplies are usually replenished at the American Red Cross every 3 weeks, but we've had no new units given or replaced. That's one doctor, one hometown, one hospital, but it's people in Kansas, it's people in this country who we know and care for, people we love, people within our families, and people we don't even know. The most vulnerable patients among us rely on blood donations for transfusions to support essential treatments, such as those of battling cancer or living with chronic diseases. There is no substitute, there's no alternative. Our nation can turn to the absence of blood donations. The only answer is for each of us to stepping up to donate, helping to end this crisis and contributing to saving lives of those in our communities. The shortage is severe, and it's affecting Kansas health providers and their ability to care for their patients. It will cost us lives. Kansans pull together in times of need, and I encourage everyone in Kansas and across the country to donate. In the United States, every 2 seconds someone needs blood or platelets, and donating blood is one of the most tangible actions we can give to help save lives. Donation centers provide specific guidance on blood donation process and safety measures taken within their centers. You can find a location that's accepting blood donations near you. You could visit the American Red Cross website. And so just the plea that we all consider donating blood to help save the lives of our friends, our neighbors, our fellow Americans. Mr. President, I yield the floor and note the absence of a quorum.
The clerk will call